Did you know that falls are the leading cause of death for adults 65 years of age or older in the United States? Doesn't matter if you're male or female. This is higher than heart attacks, strokes, and cancer. Stiff joints, weak muscles, loss of agility leads to falls. So keeping your joints well lubricated and gliding smoothly helps maintain balance, agility, and grace. Joints stiffen due to old injuries, certain medical conditions, the simple wear and tear due to gravity over time. In each of these, there's excessive friction which irritates the cartilage, the joint slackens, and the bone itself may get absorbed or it may start to create calcium bridges so that we give up our flexibility for a fused joint. This irritation is called arthritis, and it's the leading cause of disability in the United States.
But overall, I feel a little more energetic than I have been, feel stable.
My chiropractor was impressed with what the program has done for my back.
Everyone started noticing that I'm much energetic and feeling positive.
This is a photograph of one of my patients I took care of for more than 20 years. He developed rheumatoid arthritis at a very early age, but look at the degree of the deformity. Confusing, isn't it? It can be in the bones or in the joints, or it can be a systemic disease, as in psoriasis, where it's associated with things like fatigue and changes in the skin and changes in the nails, discoloration of the skin, rashes. There can be other associated symptoms like brain fog.
I've been working on healing my brain fog, I would say 7 years. Crippling fatigue, but this is like no other. It's easy to say, I know enough. I'm finding that my body is seemingly open and receptive to my supplements and my medication like never before. I would never change this journey for the life of me.
So with good intent, our medical community continues to evolve treatments to things which might actually impact the progression of your arthritis. We've moved from cortisone shots to something called hyaluronic acid, a lubricant that can be put between the joints to give them more grace and movement. We've invented things like monoclonal antibodies. And then orthobiologics, like platelet-rich plasma, often referred to as PRP, or human cellular therapies, like stem cells, and growth factors like exosomes. What's been the greatest limitation for you at the beginning, and how has that changed?
Well, the greatest one was the stairs, going up and down, particularly going down the stairs. But that's improved. That's improved.
Before you started treatments, what did your orthopedic surgeon recommend for you?
He said you will probably need to have a knee replacement because your arthritis gotten worse since the first MRI.
Now, some of you say, oh my goodness, that stem cell stuff, that's so expensive. Well, at our clinic, there's a lot of things that we can do to regenerate your cartilage, regenerate your joints, regenerate the lubricating sac. We have pulse magnetic field therapy, low intensity shockwave therapy. We have triple wavelength continuous and pulse laser therapy. Yes, we have ultrasound guided regenerative injections like platelet-rich plasma, human cellular therapy like exosomes and stem cells. We also offer nutritional guidance for anti-inflammation. We also offer very, very good guidance on dietary changes and nutritional supplementation, which can not only decrease the chronic inflammation in your joint, but actually assist your body in rebuilding the healthy tissues. Don't forget vitamin D3. This is not really a vitamin, it's a hormone. It's a hormone for the immunity, and it's a hormone essential to the building of your bone. And estrogen in both men and women, coupled with vitamin D3, is essential for the regeneration of bone. We will track your bone over time with what's called bone resorption studies. We can actually see the big breakdown products of your bones and of your cartilage in your urine and your serum. We can do laboratory testing to see the effectiveness of every regenerative therapy you're going through. We can look at your blood and your urine for the breakdown products on the remodeling of your bone and your cartilage. Are you having a net gain or are you having a net loss? We can adjust your therapy depending upon the answer to that simple question. It's not very funny when it comes to your pain. It's not very funny when it comes to your loss of mobility, your risk of falls, and the collapse of your social relationships because you can't get out and get around and enjoy the things that you like to do with the people that you like to do that with. I'm committed to you having a happy and fulfilling life in your natural lifespan. Most orthopedists will say put off that joint replacement as long as you can. I agree. We have things that work better than the good old cortisone shot. Cortisone shots actually weaken your cartilage in your bone. They also put you at risk of infection. They put you at risk of heart attack. Our regenerative treatments are safe, easy, convenient, practically painless. And in some cases, we don't even use needles to pierce the skin. So whether it's arthritis in your spine or arthritis in your knees or your hips or your neck or your shoulder, we're happy to evaluate you.